Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Hello, everyone, and welcome to another episode of A Snowball's Chance in Healthcare. My name is Josh Butler. I am the president of Butler Benefits and Consulting. We are a local healthcare consulting and brokerage firm, co-founded in 2015 with my lovely wife, Allison. And each week on A Snowball's Chance in Healthcare, this show is a show about restoring hope in healthcare. So many people that we talk to and companies that we consult with have lost hope in healthcare. They think there's nothing that can be done to improve access or to improve quality, or the bigger problem is to reduce costs. Healthcare has become such an issue with so many families and organizations, and particularly the cost of healthcare. And I'm really excited today because this week we're going to be talking to a very special guest and a friend of mine. And she's not just a friend. She is my personal primary care physician. And so let me introduce Dr. Deborah Moore. She is the founder and CEO of Amarillo MD, and she runs a practice called a direct primary care clinic, and that's what we're going to talk about today, DPC. And it's it's not a relatively brand new concept. It's been around for quite some time, but it's still foreign to a lot of people. And I can tell you guys, from the patient perspective, not just from a consultant perspective, DPC is phenomenal. And welcome, Dr. Moore.
Thank you so much, Josh.
Yeah, so tell us a little bit about Amarillo MD, and we're going to dig in with the audience, and I'm going to ask you some questions. Maybe we can tell some stories. Many people in the audience also read my blog, and they also know that I had severe COVID pneumonia a little bit earlier this year. It was kind of scary for us, but tell us a little bit about Amarillo MD first.
Sure, yeah. So I started Amarillo MD in June of 2016, formally. And that was a transition I made out of corporate healthcare. I decided that to be the doctor that I want to be, I could not do that in corporate medicine. So I found an article on a doctor who had done something similar and thought, I can do that. It's a monthly membership model. So the patient has predictable expenses every month, and then the doctor has predictable income every month. And I thought, I can probably do that. That sounds like a pretty simple business model. I kind of have a knack for business already. And so I hung a shingle out and actually started with house calls from my car, and it just took off like wildfire. So my first patients just told their whole families and said, "You've got to meet my doctor. Let me introduce you." And so it just went from there, word of mouth. The Amarillo community talks to each other a lot, and they liked what I did. So they came, and now I have an office and close to 500 patients, and we're just growing and in a great spot right now.
That's amazing. I am one of those patients. My family are patients of Dr. Moore, and so we've been with you for many years. And so, for lack of a better description, so for people that are like me, think Gold's Gym, right? You have a membership, you pay a monthly membership, and you can utilize the services of Amarillo MD and Dr. Moore. And is it always like where you have to go into the clinic and they have to see you eyeball to eyeball? Is it like the corporate side of medicine, the fee-for-service model, where I've got to see you, you got to come in so that you can bill for a bunch of different services?
So, yes, you said the evil phrase fee for service because because that's actually the complete opposite of DPC. So DPC takes out the fee for service where the patient always has to come in, pay money, and then see the doctor, or pay for every little thing that they get done. We've eliminated that. We do things that make sense, like if a patient has a urinary tract infection or symptoms, they might be able to just go and take their urinalysis or their urine sample straight to the lab, drop it off, and then go pick up their antibiotic, because we have incredible remote care. I don't call it telehealth, because telehealth is kind of just this random doctor that you call or nurse practitioner that you call. My patients know me and I know them. So it's not random telemedicine. It's not teledoc. It's your doctor taking care of you on a secure app. So we really have a very sophisticated way to do that.
Yeah, so your patients don't have to see you in person. So if I'm traveling on business and I don't know, my allergies flare up real bad and you want to call me in a prescription or send in a prescription for me, I can send a text through this application and you can take care of me that way. So I think that COVID really, I would say, exacerbated that or, sped that up, the use of virtual care. And we're seeing it kind of start to go back down now. People aren't utilizing teledoc and I know this isn't teledoc, but even virtual services, they're not using them as much anymore. But other than that, how did COVID affect your practice? And I know that you're very proactive, and we'll kind of get into my story here in a little bit, but how did COVID really affect your practice?
Yeah, we didn't really miss a beat. I did have a month-long quarantine when my family were positive for COVID, and I had to just kind of keep extending my quarantine because I didn't get it. So I actually worked for a month straight at home doing exceptional care for everybody. And again, our remote care is just stellar. So we didn't miss a beat. And I would say we actually gave superb COVID care. I had 0 patients die from COVID. And I was really proud of that, thankful to God for that. And we had a great protocol, and I ended up writing a small ebook on COVID treatment as well recently. So
let's talk about that quality of care a little bit. So in the United States, the average amount of time that a person spends in a primary care doctor's office when they go for a primary care visit is right around 15 minutes. Now, that's not very long. Now, under the DPC model, I know that some of my earlier doctor visits with you years ago lasted almost 2 hours. You do a very thorough job. Tell us a little bit more about, practicing at the top of your license and how that ends up, not just a better member experience, a better patient experience, but how it saves money as well.
Yeah, so our first visits with patients are usually an hour and a half to 2 hours. And most of my new patients say, I've never been listened to like this ever before, or I've never had anyone go through my labs line by line and explain them to me. And they are sometimes just in tears because they've never been able to just talk to a healthcare provider for that long. The reason that makes my job easier and my treatment better is because that's what I went to school for. So being trained in family medicine, we're trained in all of the specialties. So if I have an hour and a half or 2 hours to just talk, I can put all that together at that conversation and come up with a healthcare plan for you that's going to be much more effective than someone can do in 15 minutes.
Yeah, so that was my follow-up question is how effectively can you do that as a physician in a 15-minute increments? I know that they may see patients for years, but even in 15-minute increments, there's an enormous amount of pressure on doctors to prescribe a medicine, order an image or a diagnostic exam, or to refer to a specialist. And all of those things, guys, and the reason this is important is because that drives up the cost of healthcare, that when physicians are simply given enough time to properly treat patients, then it can mitigate or even eliminate some a referral to a specialist or an MRI or a CT scan or an urgent care visit or something of that nature. So that's where the cost savings component comes into DPC. So is DPC just for individuals? What if you're talking to a company that has 20 employees and they say, hey, I really like this concept. I really like delivering this philosophy of delivering very high quality healthcare at a capitated price, a known price. When I talk to businesses, they love this because they know how to budget for healthcare services and benefits for their employees. So is this just a model for individual patients?
So no, this is phenomenal for employer groups. So let's talk about that 20-person group. They often are not able to afford the severe high cost of, a low deductible insurance plan for catastrophic. Even if they are, it's usually high deductible. So $6,000 deductible, those are still very expensive. So they might not have any benefits at all medically. And so this is really crucial for those small businesses that don't offer anything. This is a phenomenal way to take care of your people in a way that even those who are paying for an insurance plan, lots of dollars for an insurance plan, are not recognizing or feeling those effects. So you could have a little small company with phenomenal health care with this, because you can pay a membership fee every month per person that you want to cover, or you could even have them pay half of their own. You can, kind of work it however you need to in your HR department.
Yeah, that's a great, even small companies don't have HR departments, though.
That's
they
true.
might have one person. It may be the owner today he's wearing the janitor hat, tomorrow he's wearing the HR hat.
That's true.
So, let's talk about that for just real quick. These smaller employers, I'm often asked, hey, we want to be able to offer some type of benefits to our employees. We want to be able to offer, something to try to stay competitive in the labor market, because it's always the second question that gets asked, right? When you are trying to hire somebody, the first question they're going to ask is, what are you going to pay me, right? Second question is always what?
Benefits.
What benefits do you offer? And so small employers, as the cost of health insurance just keeps going up and up and up and up, these small businesses are just telling us, hey, we simply can't afford to do this. So what else can we do? Let's get creative. And I think DPC is one of those solutions that we've always supported. It's something that we've always, we've probably referred a bunch of patients. I know I have. I've referred a bunch of patients to you over the years to say, people that come to us all the time say exactly that. I can't even afford health insurance, but I need to see a doctor. I need to get medical services. So that's one of the huge reasons that we're such big proponents of DPC. So today, for those of you that might just be joining us, we're talking to Deborah Moore. She is the CEO, Dr. Deborah Moore, CEO and founder of Amarillo MD. She runs a direct primary care practice here in Amarillo. And so let's transition a little bit. And, it's not a huge transition, still on this level of quality, but many people, that read my blog, they know that, when I had severe COVID and everything, and I want to tell a real quick story because Dr. Moore did an amazing job, and in my blog, I even say that she saved my life, and I honestly feel that way, and it was the coordination between my physician, Dr. Moore, and my wife, Allison, and my mom came, and my sister came from the Dallas-Fort Worth Metroplex, and for a period of about 2 weeks, I received around-the-clock care. I had very severe COVID. My oxygen levels were, plummeting in certain situations, but I avoided the hospital because that was something that you and I had discussed. And I tried to, avoid the hospital at all costs, right? So let's talk a little bit about that. Like, why, from your perspective as my doctor, why do you think it was important for us to take the strategy that we did to try to avoid the hospital?
Mm-hmm. Yeah, that at that point was all about the healthcare and your medical care. So at that point in the hospital, there was still a lot of paralysis with the medical community on what to do about COVID. And there was also a lot of, I think, political reasons why certain treatments weren't being used in the hospitals. And there really was paralysis, I think, among the doctors. And so instead of even just treating inflammation with steroids, there were many people going to the ER and not getting things like steroids or, antibiotics. It was really kind of just mass chaos. So I had already been treating COVID for quite a long time when you had that severe case, and I knew how to treat it. And so, our normal COVID protocol started with things that don't really give a lot of side effects, but then we escalate it when people get worse. And so, you got more inflammation and started to have more problems with your oxygen levels. And so in addition to treating deficiencies and your vitamin levels and things that were efficient at treating COVID, we also then added on some steroids, some other medications then to help you kick it quickly. But you were one of the scariest cases I had, which you got really, really severe.
That's a HIPAA violation.
You opened up that can.
I know I did. I totally opened that. It was a softball to you. I don't mind talking about it. Because it was a learning experience for me. And I got a lot of, it kind of went viral. I shared that story, and I think you shared in your book that you wrote and everything. But, a lot of people reached out to me after that and said, hey, we so appreciate, because I gave a lot of tips, about how to keep yourself, your O2 levels up, how to, take the right supplements and, what to really kind of look out for. And I learned all that from you, So I'm certainly grateful for that. I know how my wife feels about you and our boys. And and everything. But it was. So let's get back to Amarillo MD, because I'm fascinated because it was a grassroots type of movement, right? There where you just kind of started to build a practice. Tell us a little bit more about, because you've been in healthcare. How long have you been a doctor?
15 plus years.
Yeah, and how many years did you stay on the corporate side of medicine? You worked for
9.
Baylor Scott and White, and
yes, I started at Baylor Scott and White as a resident, and then moved to a big company in Denver where I actually was a medical director for 2 large clinics there, and that was urgent care and workers' comp and occupational medicine. And I actually worked in probably 25 different locations there in Denver, and then directed 2 large clinics. So, yeah, quite a lot of experience on the corporate side. Yeah,
and just from simple word of mouth, you've been able to, what's the quality of life? I know that a lot of times we hear about doctor burnout, and we're seeing it and there's shortages, especially when it comes to family medicine and primary care. There's shortages in certain areas, but so quality of life has to be, a factor in that doctor burnout, right? So for you, coming from this DPC model, tell us a little bit about your quality of life and what DPC provides for you.
Yeah, so DPC really increases the quality of life for a physician. Now, I will kind of separate the two of the founder-owner of the DPC has that business owner hat on also. So I'm busier than most of my DPC doctors would be who work for me, only because I wear that hat too. But as just a DPC doctor in a well-run office like mine, that DPC doctor who transitions, a lot of them will come from inpatient hospitalists who've been trained in family medicine. They'll come out of that and enter into the DPC clinic world. So they would have much lower patient panels. So usually a doctor would have maybe a 3,000 patient panel, and the more the merrier in the corporate model. Just, that doctor makes more money for the corporation, the more they take care of and the more they see every day. That is not how we do things in DPC. So the doctor is not pressed to see as many people as possible in as short a time as possible. They're actually encouraged to take as much time as possible with each patient and do it right and do it well and do it personally than they are to take a lot. So we have panels that are like 600 patients, not 3,000.
That's what allows you to spend an hour and a half,
yes.
and just be really responsive to your patients.
Yes.
I know during my sickness and everything, it was amazing because multiple times a day you were returning texts and you were returning phone calls with my wife, and you came and I sat in the car and you came out and to check on us. And so it's just, guys, the level of service. You might even, I don't want to call it concierge medicine because I know that there's a distinction between concierge medicine and direct primary care, but that's a whole nother conversation. But that's amazing. So, you talk about these panel sizes. You're seeing approximately 600 patients. So how do you scale for growth? So you just hire on more doctors? Do you utilize mid-levels at Amarillo MD as well?
So yeah, we do both, and we're actually in a great spot right now, and I'm super passionate about teaching other physicians and mid-levels how to take care of people better. And that's something that every doctor wants to do, is take care of their patients better. They're just not put in a model on where that can happen. So this is the model where that can happen. I happen to just think it's a dream world for a doctor, especially family medicine.
Yeah.
And even naturally minded family medicine doctors do really well in this because there's more time to think through everything. Whereas in that 5-minute visit, the 10-minute visit, the doctor's actually trying to pick the most effective and biggest bang for treatment, which is why if you go in for reflux, they're just going to give you an acid blocker prescription. That's all they have time for. That's all they've ever been able to research. So this just flips all of that on its head for everyone involved. The patient, the doctor, the mid-levels, everybody gets stellar care.
And guess what? You don't take insurance.
Right. No,
okay,
happily no.
Right. So this is a question that comes up a lot. When I talk to companies and I talk to people about direct primary care, they're like, how does this doctor stay in business? How do they make money if they're not charging insurance companies all these, and filing a bunch of claims and things of that nature? So obviously, you're successful. You've opened a practice, and it's been open since 2016, and it's thriving, and it's flourishing. So we often preach to our clients and our prospects that you don't need insurance for everything. Right. And this is a primary example of a cash-based, it's pretty much a cash pay model, a cash-based model. It's not an insurance-based model where people can receive what you've described, in my opinion, and from my personal experience, is much higher quality health care at a fraction of the cost.
Right.
So one of the reasons that health insurance is so expensive is because it covers, right, quote unquote, it covers everything. But here we have a solution, a strategy that you don't have to have insurance. As a matter of fact, she won't take your Blue Cross Blue Shield. She won't file claims for you, okay? It's not her model, and it's worked. So let's talk about that a little bit. Financially, you don't have to disclose numbers, but, this model works.
It does.
Even from a financial model.
Yes. So I can tell you, our membership is very simple. It's $80 a month per adult, and it's $40 a month per child. And those are our two prices. So we don't have age tiers. At one point, we had age tiers, and it was just hard to keep up with. And we thought, you know what? Let's simplify this. So 80 for adults per month and 40 for children per month. So, that becomes easy to budget for, but I have always kept my overhead expenses down very low. I don't take debt. I just grow based on the capital that I have. So I could have grown faster, but I chose not to. And I have developed this engine under the hood for healthcare that is really, really good. So I really, I definitely think people pay way too much for their health care. And, we probably have to talk about how using insurance, people get charged way too much.
Yeah.
So I have a quick story I can tell. The year before I went into DPC, I actually paid over $10,000 out of pocket for my family's health care.
On your deductible?
Yes. My deductible was $1,000. So this is with really good insurance. So I had one child who had to get a CT scan. It was not an emergent CT scan, but it needed to happen. We were charged $8,000 for that CT scan, and then we paid the first $1,000 as our deductible, and then we had a 20% co-insurance that we paid after that. Well, that's $1,400 is 20% of $7,000, so we paid $2,400 total for this CT scan. Do you know the cash price of that CT scan?
I know what mine is.
Yep.
$370. Oh, you're getting it for $350. I mean, my price is $375, and so
with contrast,
exactly.
It's $375. So yeah, $375 for something I paid $2,400 for. Then I had to pay. One of my kids had strep and had a complication. One of them had RSV and had an ER visit, and one of them broke her arm and had a cast. That added up to $10,000 a year. For that year. That's ridiculous.
Yeah.
And I am very passionate about American families not being put into debt over having 4 children who had one thing every year that most kids have. So that's one of the reasons I changed over. I told my husband, kind of just joking, we're going to do DPC just so our family can have care.
Well, I can tell you from an ROI perspective, because I've utilized your services over the years, and it's not just because the question comes up. Look, she's a primary care physician. She's not a specialist. She's not a cardiologist. She's not an oncologist. She's not she's not a hospital system, right? So when you have to send patients for what you call intangible services, things that aren't covered, that you don't do because they don't fall within your specialty, and you have to send people out. Labs come to mind. You don't do your labs in-house. You send them out, but you have an agreement with the lab. And so here's what people need to understand. In the insurance model, that lab may run $140. Dr. Moore.
And that's $4 for me.
$4 for you. So we're doing similar work in that we are trying to help our clients, your patients. I don't get to call them patients, right? They're my clients. Find the health care that they need at an affordable price.
Yes.
I recall one time I did a stress test with you, and I was cash paid, didn't use my insurance. I went to a place here locally where you have an agreement, and I paid like $300 for the stress test. And that through insurance, you may tell you what that test would have ran me? Yeah, it was over $1,000. So if when people ask this question, here's why we use these examples as we kind of start to wind down here, is that if you're saying, well, if it's $80 a month, that's $960 a year. What if I only go to the doctor once or twice a year? That's not really a good investment for me. And if you're just looking at it from the perspective of 2 doctor visits a year, okay, you have an argument to make. But I'll tell you something. When you have to factor in the cost of your lab work, if you have to have a diagnostic exam done, you help me get a piece of medical equipment at your cost. The savings I've experienced because of how you've helped me find cash deals for myself in the past has more than paid for my annual memberships for my DPC for your practice, right? So I want people to understand that. So
Yep.
Well, guys, any last words, Dr. Moore? We got a couple of minutes here.
Take care of yourselves. I mean, do what you need to take care of your bodies and prevent things. And really, preventative health is the name of the game, and that keeps you from having health issues in the future and spending more money on your health care. So, yeah, we love it.
That's right. Well, this week, it's Dr. Deborah Moore. Her company is called Amarillo MD. Dr. Moore, how can people find you? How can they get in touch with you?
Yeah, so AmarilloMD.com. It's very easy. Just go to that website. AmarilloMD.com. Okay, well, ladies and gentlemen, that's a fantastic direct primary care. We use it. We use it for our clients. I use it in my personal. That's what I do personally. It's what my family does. We've referred a bunch of patients to Dr. Moore. Thank you so much for coming on A Snowball's Chance in Healthcare. What do you think about the title of my show? I love it. I love it. It's so great.
Well, that's going to do it for this week. I'm Josh Butler, president of Butler Benefits and Consulting, and every week we are arming employers and families with solutions like Amarillo MD to give you a snowball's chance in healthcare.